And the next study I wanted to show is a different kettle of fish, which is how misleading some of the headlines that you see and some of the things that, if you don't really investigate, you could end up believing unless you actually find out what they did. So, this is a FDA says COVID vaccinated at risk of sudden death for 15 years. Now, I just want to point out that many people should say, well, I should applaud this because the FDA made an alarming admission revealing that people who receive the COVID mRNA vaccines are at risk of suffering a sudden and unexpected death for up to 15 years after they received their last injection. So one would think, because I don't think anybody should have gotten or should get any COVID mRNA vaccine or any other mRNA vaccine or any type of vaccine. So that's very clear. So why aren't I jumping up and down? See, we caught them red-handed. This COVID vaccinated people are at risk for sudden death for 15 years. Can you imagine that? 15 years after getting the shot, they still have a risk for sudden death. But the reason I looked at this and said, I got to look at this study is because I would say, adamant in saying that we cannot use bogus studies that claim even things on our side because ultimately they will be debunked and we will look stupid and foolish for publishing nonsense. We can't combat nonsense with other nonsense. So I said to myself when I read this, wait a minute, nobody has had a COVID shot 15 years ago. So how did they know that they're at risk for sudden death for 15 years? And then I looked down and then I saw the research was conducted by Peter McCullough and somebody else, Nicholas. And then I knew I had to look here because this is what you call a high probability of being total nonsense. And again, even though one might say, but Tom, this is on our side, so why aren't you applauding this? We cannot use our own nonsense to combat their nonsense. And so what was the study? So here it is, and I couldn't find the study because I don't know if it's published yet, but here's the citation. You can look, delayed fatal pulmonary hemorrhage following COVID-19 vaccination, case study, batch analysis, and proposed autopsy checklist. So again, the claim is COVID mRNA shots increase the risk of sudden death for 15 years. So what did they actually do? They presented a healthy 47-year-old Caucasian male that died unexpectedly from acute pulmonary hemorrhage 555 days after completing the Pfizer COVID-19 vaccination primary series. So in other words, one patient who died allegedly from an acute pulmonary hemorrhage, bleeding in his lungs, 555 days after receiving the vaccination. Now, again, whenever somebody says the clinic or wherever that they had a COVID shot, I always suspect that that may be the part of their problem, or we do. It doesn't prove that it is. But in this case, if you're going to publish a paper, so what did they do? So a guy had a healthy medical history, no meds, rapidly deteriorated, experienced severe respiratory distress, followed by cardiopulmonary arrest with evidence of profuse bleeding. Yeah, so the guy died, and so they did an autopsy on them, and the findings revealed a lung congestion without embolus. So there was no clot, normal heart size, some atherosclerosis, no heart attack. So despite this, they said he died from hypertensive cardiovascular disease without really any evidence for that, without considering the recent pulmonary hemorrhage and unremarkable medical history. And so then they give a whole long list of things they failed to investigate, such as the spike protein, vaccine RNA, antibodies, et cetera, et cetera. So, if anything, they said there's no blood clot, according to this autopsy. That doesn't mean it's true. But this is hardly evidence that 15 years after getting these shots, that you're at risk for sudden death, because this is not even 2 years. So the headlines don't actually are not corroborated by this study. And in fact, the autopsy results say there was no clot. That doesn't necessarily mean there wasn't. I'm not saying that. But my point is, this is not a study that can substantiate that claim. This is, I think, what you properly call fear porn, and we should be just as skeptical of this as counterclaims, because we cannot win this war based on poor science. We have to do things properly, and just because they sort of corroborate our position, if they should be called out just as much if they're bad science from our, quote, our point of view as from theirs. That's my point.